U.S. Border Patrol agents seized hundreds of pounds of cocaine, attempting to make its way into San Juan. The ship carrying the drugs coming from the Dominican Republic was being inspected when a canine alerted to pallets of merchandise hidden inside a container. After further inspection, officials discovered 395 pounds of cocaine worth an estimated value of $3.5 million. Now, Homeland Security Investigations has since taken custody of the contraband for investigation. Well, meantime, St. Lucia has received confirmation from the Caribbean Public Health Agency of its first case of the Omicron subvariant BA.5. Global health authorities say BA.5 is the most easily transmissible COVID variant, evading previous immunity acquired through previous COVID infection and vaccinations. Now, according to St. Lucia's Chief Medical Officer, Dr. Sharon Belmar-George, the case is a 36-year-old woman without a travel history. She says this suggests in-country transmission of BA.5 in the presence of other cases.
As we continue to note the return to normalcy with the opening up of events and mass crowd activities, we need to ensure that the proven public health measures are in place to prevent us from getting sick and to protect the most vulnerable. The public is reminded that the threat of COVID-19, long COVID, and its complications still exists, especially given St. Lucia's low immunization rate. Personal responsibility is extremely important at this time to reduce transmission of infection to ourselves and our family. The public is guided to continue the use of face masks in public, ensure hand washing and proper general sanitization. The public is also advised to use their discretion, ensure that they and their vulnerable family members are fully vaccinated and boosted before attending mass crowd events.
Meanwhile, the Ministry of Health says it is closely monitoring the multi-country monkeypox outbreak and has increased its surveillance for early detection and management of cases, saying that as of last Friday, the Ministry of Health had reported on the alert received from the Centers of Disease Control and Prevention of the contacts of a positive crew member. The contact tracing and self-monitoring of those exposed were carried out.
St. Lucia has not recorded any cases of monkeypox to date. Presently, everyone who has been exposed has been cleared and in good health. The signs and symptoms of monkeypox include rash, fever, enlarged lymph nodes and back pain, and muscle pain. Testing for monkeypox in the region is facilitated through the Caribbean Public Health Agency.
Well, now to headlines from the Bahamas. Some recreational use of marijuana could soon be legal, and the country's leader will also be focusing on improving education throughout the Bahamas. Our One Caribbean News' Deandra Hamilton reports.
The Bahamas will soon have a legislation for the legalization of some use of marijuana in the country. This from Prime Minister Philip Davis.
The issue of marijuana, the legalization of marijuana, what aspects of it will be legalized is under active consideration by my administration. You would have noted in our blueprint for change that we did acknowledge that medicinal use of marijuana is acceptable to us. It's just a question of whether we're going to move as far as recreational marijuana.
Davis was speaking at the Meet the Policymakers lecture series at the University of the Bahamas on Tuesday and was responding to a question about the government's national development plan and where marijuana investments fit in. Earlier this year, Minister of Agriculture, Marine Resources and Family Island Affairs, Clay Sweeting, had indicated that the Family Islands in the Bahamas would be ideal for supporting the cannabis industry once legalized. During Tuesday's lecture series, Davis presented a thorough outline of his administration's national plan and areas of focus. One area of focus was education, which he said was the path to empowerment and prosperity.
I spoke earlier about the deprivation of education as an instrument of oppression. But a more positive way to say that is that education is the path to empowerment and prosperity.
He also noted that his administration's approach to education gives Bahamians the opportunity to take advantage of the orange, blue, and green economies.
This has been true of my own personal journey and that of countless others. What is distinctive about our approach? What is distinctive about our approach? Well, we will educate not just for the broad curriculum, but also to ensure that Bahamians can take advantage of the opportunities we are seeking to stimulate in the orange, green, and blue economies.
And that was our Deandra Hamilton reporting there. Well, meantime, it's one of the most common forms of contraception people use, but birth control pills do require a prescription in the U.S. But now, following the overturning of Roe v. Wade, a pharmaceutical company has submitted an application to make a birth control pill available over the counter.
If approved, it would be the first daily birth control pill available over the counter without a prescription in the U.S. HRA Pharma is hoping the FDA will give the green light to Opill, a progesterone-only pill.
A lot of the risks and side effects in combination pills come from the estrogen.
More than 65% of women ages 15 to 49 use contraception between 2015 and 2017, according to CDC data. Of those, about 14% used oral contraceptive pills. Right now, those can only be prescribed by a doctor or, in some states, a pharmacist. So the American College of Obstetricians and Gynecologists calls the application an important step toward dramatically increasing access to birth control across the country.
It's incredibly safe, and there's very rare instances where a woman shouldn't take it.
Atlanta OBGYN Dr. Sujatha Reddy says her only concern would be making sure patients still come in for routine exams, even if they can get birth control over the counter.
That may not be in their best interest to miss those exams where we can hopefully find things ahead of time.
HRA Pharma says it typically takes about 10 months for the FDA to review an application for a prescription to over-the-counter switch.
And that was our Emily Matson reporting there. Meantime, last week, doctors and prescribers said they were seeing an increase in demand for different forms of contraception, including emergency contraception and longer-lasting birth control.